So it was a Wednesday, and I knew Jourdan was coming into the office because she was 28 weeks. She was coming in for her checkup, and she was feeling fine, not having any symptoms. But with twin pregnancies, preterm labor and preterm labor symptoms are common. So as she was entering the third trimester, I was asking her questions. Are you having any contractions? Are you feeling the baby's moving well? Any bleeding? The common questions. And, you know, Jourdan is my medical assistant, and she's seen me practice many years now, and we've worked together for a really long time. So she knows exactly what to say to me to not worry me, but something was off. She didn't feel well that day. When patients have twins, we're a little extra careful because they don't have all of the typical symptoms that someone who goes into preterm labor. Sometimes they may not have contractions, but they could still be dilated. So I asked her to get an ultrasound and examine her. So during the ultrasound, the sonographer, Brenda, who's been with us for many years, 12 plus years, said, I wanted you to come in here, Dr. Gandhi, and take a look. And that's never really a good sign when she asked me to do that. I could tell that there was a very thin layer between the baby's presenting part and the cervix. And that means that the cervix has either started to dilate or shorten, and now there's very little protection or distance between the bag that holds, the baby in and the cervix. So we did a speculum exam in the office where, just like when we do your pap smear, I put a speculum inside just so I can visually check her before I actually did a digital exam, and I was able to see right away that she was dilated. Of course, if this is someone that you know very well, you don't want to worry them. I took the speculum out and I told her, I think we're going to send you to the hospital for some observation. In the back of my head, I knew what this means. She's very early. She's only 28 weeks. She's already 2 centimeters dilated, and she has twins, which, is all a package. It's kind of like a ticking time bomb because you don't really know, and you have to be kind of conservative at the same time because the babies are early, but you don't really know, how much time you have in order to make sure that the babies have the best chance of surviving and doing very well should they be born early. And at the same time, making sure that we're taking the precautions we need to get her to the right facility and be around the right pediatric care. So as a physician and, her physician, it's hard because I have to be very objective and talk to her about potential things that could go wrong, but at the same time, make her feel comfortable. And that's very hard to do, especially when you're dealing with, babies that are not even 2 pounds, and trying to talk to her about the potential risks involved with delivering early, and at the same time trying to stop her contractions and make her feel calm. We were not able to stop her contractions to a degree where we felt comfortable. So I did send her to Northside Atlanta, where they have a NICU that's equipped to handle very early care like that. We will now, have that ability here at Cherokee, but at the time we didn't. Preterm labor, happens in 11 to 12% of pregnancies, and it's scary because sometimes it's a false alarm. Many times it's a false alarm, but when it does happen and it happens that early, it's so important to recognize it and to intervene as quickly as possible so that we can give potentially the baby or babies enough time to get prepared so that the pediatric staff and the NICU staff have the best chances of providing great survival. And, you know, with the way technology is now and the use of surfactant, we have the capability to take care of these very, very premature babies. Each moment the mom is away from the baby because the baby's in the nursery, you know, it's heartbreaking. It's very difficult. And, you know, I sympathize with all of these women that have had this issue, not only because I'm an OBGYN, but because, you know, Jourdan, who's my medical assistant and also a very close friend, you know, I saw her through that side, not just the medical side. So it was very interesting. But, you know, as obstetricians, we have the joy of delivering babies and everything is going fine and everything is normal and everybody's excited, but we get to see emergencies too. And it's so hard because you are giving life to someone who's helpless and requires all of your attention, and you just can't have a bad day. You just can't. It was a little intense, but in the end it all worked out. She was completely stabilized. She ended up, you know, delivering a few months later, and you know, they did great. Briar and Wyatt are her sons, and it's such a blessing to have someone in our own Cherokee women's family have a great outcome like that, and me being a part of it, it's just a huge privilege.